Welcome back to Lift You Up Inspiring Health Stories. I'm your host, Tamika Bickham. I'm the founder and chief storyteller of TB Media Group, but for the purpose of this podcast, I am your health and happiness matchmaker. Now, before I introduce you to today's guest, you know what I'm going to ask you to do if you haven't already. Hit subscribe on YouTube, turn on those notifications, and connect with me on LinkedIn, because I'd love to stay connected with you. Now, today we are talking to Bevan Choate. And he's answering a question that I had, which is, what happens when medical professionals end up on the other side of healthcare as a patient? It's an interesting story because he's a surgeon who ended up happening to have a stroke in just his mid-30s. He's sharing that story and what's happened since. Our physical, mental, and emotional health is not just a want. It is a need for happy lives and prosperous businesses. Lift You Up is the podcast where we share inspiring health stories from business owners who are fulfilling their purpose to live their healthiest lives and helping you do the same. From former TV reporter to marketing entrepreneur and content creator, I care about sharing stories that matter and stories that connect us. I'm your host, Tamika Bickham, your health and wellness matchmaker. Well, today I'm so excited to meet and welcome to the show, Bevan Choate, all the way from Albuquerque, New Mexico. But luckily we can connect because we're connecting virtually. So welcome. Nice to meet you.
Thank you, Tamika. I appreciate it. And big fan of your show. So thank you for having me on.
So you have a fascinating story and love telling stories, especially stories around health on this show. So before we kind of dive into that, answer the question, who is Bevan Choate?
So I'm Bevan Choate. I'm a 37-year-old urologist right now, and I'll kind of set the scene. So back 2020, I was about 2 years out from a 5-year surgical residency in urology. I was finally seeing that light at the end of the tunnel. I had taken a job. Everything was coming up aces and everything looking good. And then out of the blue, I woke up one morning with a massive stroke.
When you woke up that morning, did you know that you were having a stroke?
I didn't. I think in hindsight, a few more things make sense, but really my symptoms were pretty atypical for what most people would think about, when they hear about stroke. And by that, I mean that, a lot of people, they would say, well, did one side of your body go limp? Did you have trouble speaking? Were you slurring your speech or anything like that? And I had none of those things. My big issue was complete loss of balance. Like when I tried to get up to do my routine in the morning, I just fell to the floor like a ton of bricks. And the room was spinning. And so my initial thought was that I just had kind of an inner ear infection or disorder. And so, yeah, stroke was definitely not my first thought.
At what point did you realize that you were having a stroke?
When the ER physician told me, yes, in fact, you have had a stroke. When they finally did a CT scan, and I even tried to avoid going through the CT scan initially because I was like, seriously, like, don't waste the money on me. It's like,
Right.
come on. And yeah, so that's when it really hit me, and I was just like, oh no, you know.
What happened after that? I mean, did you realize once I guess that kind of sunk in that, hey, I had a stroke? Did you find out potentially what caused it? What got you to that point?
Yeah, no. So it was just one of those things where it's like, you just this is your luck. This is this is what's going on. I exercised quite a bit. Had a pretty healthy diet. Didn't have any really risk factors that you would think of for a stroke. And so it was just one of those things that happens to people. And so people would say it's unfair and everything, but at the same time, it happens. And so that's where I'm at.
At least luckily, I mean, if you thought you had maybe like an ear infection, you went to the ER. So it's good that you did that, right?
Well, I owe all to my wife, who's also a physician that is a hospitalist, and she said we need to take you to an ER. And of course, being the stubborn surgeon, I said, "What are they going to say, right?" And she finally convinced me and made me go to the ER, and it was ended up being a very good thing. But given that they couldn't tell me exactly when this happened, and I mean I couldn't tell them exactly when it happened because it happened presumably in my sleep. um it wouldn't have really mattered trying to get there fast. And for the listeners, it's you kind of have this 2 to 3 hour window, if
Mm,
you think you're having a stroke, to really get there and say, look guys, I think I'm having a stroke. So
right.
um because it is a time sensitive issue. But
Mm-hmm.
in my case, there was really nothing I could do about it at that point.
Mm-hmm. And what were in the days, weeks, and months following some of the effects of the stroke that you noticed?
They sent me over to a different hospital, and it was actually the hospital wherein I trained. And so everyone was like, "Hey, Dr. Choate, what's going on?" Like I'm seeing all the the old friends and everything. And so, yeah, while I was in there, my balance was still very much off. I was seeing double, so they had to put an eye patch over my left eye, which was kind of cool. And then, so the main thing was that, the type of stroke that I had, which was in my cerebellum, that caused me to have really poor control of the movements of the left side of my body. So for me, mostly the left arm. And the dizziness eventually resolved, but I still have issues with balance and things like that. So those are the main things I continue to work on to this day, are really like my left-sided balance and doing all those little fine motor movements with my left hand.
Mm. And did I read that you have about 80% of a brain?
Yeah, so yeah, I love to if I love to bring that up,
You're
if I
not
screw up.
playing with a full deck, as you
Exa
mentioned.
Yeah, exactly. So, if I make a mistake every now and then, if I get to fill out some paperwork or something, I do have that to fall back on. So the big problem with my stroke was that the pressure just kept building up, in my skull, and you're inside the skull, there's no room to expand. And so they first had to put a drain in, and then that didn't work. And so they then had to remove a piece of bone from my skull to try to make a little more room. That didn't work, and so they then had to remove the part of my brain that was no longer getting nutrients or oxygen from the stroke. And um, and that's why, yeah, I don't have a completely 100% full brain anymore.
What should people know? Actually, one of our team members, our photographer we work with very frequently, had a stroke one day on a shoot. So I learned a lot about it from him going through the experience. But it's one of those things I feel like when I talk about it with people that it seems very scary because you of the short window you talked about, and also really seemingly having limited warning signs.
Right, yeah. So no, I think for most people, regular preventative medicine, which just means, going to the doctor, period, even if that's, once a year, I think is helpful, just to establish, your basics, like, do I have high blood pressure? Do I have normal blood pressure? Do I have high cholesterol? Do I have normal cholesterol? Things like that. And there are mnemonics and things out there. You see a lot of public service announcements and things that'll say like fast or be fast, which is like a mnemonic for recognizing a stroke, because I think they're really trying to tell people that early recognition is important. And I guess one step further to say early prevention is more important. And that's mostly just, seeing your doctor, period. I like checking these basic things out. So, I'm like, in my day, there was like the fast mnemonic, which is more like, looking at the face, looking at like facial drooping. There's the arms, is one arm weak or something like that. S stands for the speech. Is it slurred? Is it abnormal? Like, are they not making sense? And there's the T, which would be like, I think they call that terrible headache or something like that. So I didn't really even have a headache. I just became very nauseated, and that's an important thing I think people should know is that with increased brain swelling, people usually get this overwhelming sense of nausea.
Mm.
So so yeah, with the with the B fast thing, which I think is newer, they incorporate B for balance and E for eyes. So like looking for changes in the eye movements and balance situations. Um, I think, had I known that, it I don't think it really would have changed anything in my case because I had this during sleep, but um, it probably would have made me a little less incredulous about me, a young person having a stroke,
Mm-hmm.
and so anyway, that's what I'd say.
Is it pretty common or pretty rare that someone that young has a stroke?
I think it's very rare, but I've since gotten involved with some stroke support communities, and yeah, then when you're surrounded by people with a similar situation, you feel like it's a lot more common, but it's not, but
Mm-hmm.
it is nice to be in the company of people that
Yeah,
have shared a similar experience.
absolutely find a community around it. How has this changed your life? Because, like you said, you were, I guess, going into a new residency, or I know you're a surgeon. So, how did that impact your life and your work?
A lot, and I mean, it completely changed my perspective, I think, on what it means to, you know, lead a good and fulfilling life. And I think a lot of us, the way we're raised is, it's like, well, you got to find this good career, and your career should be your calling and your passion and all this stuff. And in my case, it was, but at the same time, I wasn't really nurturing or developing those other parts of what it means to be, a human being and to have a fulfilling life. Having a really good career that motivates you and keeps you going and happy is great. And I think, I kind of think about it's kind of like the being in the eye of the hurricane. There's a big storm around you, and you're in the middle of it, you know, chasing this goal. And the important thing to know is that life is pretty much a storm. Life really is a hurricane, and I don't think there's like an escape from it, at least not permanently. But there's you just part of life is learning how to really live and be happy in the storm.
Mm-hmm.
Like while you're in the storm. And so I think kind of putting all your eggs in one basket, like a career or something like that, is sort of like being in the eye of a hurricane. And at some point, the storm's going to get you. But yeah, so it's like I kind of thought, well, now that my career's been a little bit stripped back, or maybe stripped away, that's still yet to be seen. I'm kind of like, well, who am I otherwise? And I'm kind of like, man, there were a lot of shortcomings there. So I've since sort of changed my whole perspective, and now, I think my career is a little less. It's still very important to me, but it's not, paralyzing or anything like that to think about. I've since have a much better relationship with my wife, my family, my friends. I'm involved in stroke support communities and things like that, which has actually become, highly fulfilling and something I actually look forward to. So yeah, it just kind of completely gave me like a psychic shift or a perspective shift.
Mm-hmm. I like what you said. Life is, or part of life is being happy while you're in the storm, which resonates because I think a lot of times people are always like waiting until or wanting to get to here until they're happy or until they take that vacation or till they enjoy this moment or before they do this thing they've always wanted to do. I'll just get here. But what's true is that like we don't know if that day will ever come or when you achieve that thing or get to that place there will always be another thing still to
Exactly.
do
Yeah.
and
And
achieve.
yeah, I'm living proof of that. It was like, okay, in medical school, all I got to do is get this urology residency, and then you get that, and then all I got to do is finish the urology residency, and then you do that, and then it's like, was I really extremely fulfilled at that moment? Yeah, maybe temporarily, but not insanely or anything.
When you're pursuing that path of medical school and then residency, etc., like, is it possible to enjoy being in that storm, because it's hard?
I don't know. It's like I mean, I definitely did. And I think the things that I valued most were, the people that I was in the trenches with,
Yeah.
especially in residency, because that's when it got hard, many
Hmm.
sleepless nights and very hard work. And so, but yeah, maybe I could have done a better job of, really appreciating those moments, more than I did. But yeah, I think it's possible. It just has to be done in a different way. It can't be, maybe more mainstream methods. I think you have to kind of find your own path within.
So let's talk about The Stroke Artist. This is a memoir. I know I called it a book earlier.
So yeah, technically it's a memoir, and yeah, it all started as just a result of kind of wanting to do a some rehab on my left hand. My co-resident, one of the people that I was in the trenches with, said, "You need to write all these stories down and things that you've done and happened to you as a result of the stroke." Because he said a lot of them are really funny, a lot of them, you're going to want to remember at some point. And I said, well, I don't know. So he said, just do it. I said, well, I'll do it. I'll do it just to see if I can rehab my left hand, because I need to relearn how to type because the stroke, didn't allow me to type. At one point, I couldn't even hold my phone to text. And so I had to, I said, fine, I'll do it. And so I started writing things down, you know, things about the stroke, my hospitalization, after a few paragraphs, a few pages, like I kind of thought, well, this may actually be something, this may actually be able to help other people, that are going through a stroke or even just like a major medical catastrophe.
Right.
Because I do think there's some a unique perspective in the sense that it's a doctor turned patient or a doctor turned stroke survivor. A lot of times we hear about the patients, but we're not hearing it from both sides of the story like simultaneously. And so it kind of took on a life of its own. And I thought, I may actually be able to do some good with this. And so then it just, it was like every day, just writing, writing, writing. And, I finally had a manuscript. So I searched around and I finally got a real book publisher. And, you
That's
know,
amazing.
yeah, next thing you knew, it's just all of a sudden it's out, 7 months later, of course, but that's how it works.
Hey, I'd say that's a pretty good timeline, though, right?
Yeah. 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 So yeah, it kind of became this thing for me. And I think through that, I recognized that, I need to start practicing what I'm preaching here. And so I got involved with stroke communities and things like that. Um, and it's just been such a blessing, so helpful and fun and something I look forward to.
Well, give us some insight into what we learn, read in the book.
I'm hoping to try to convey, what's going on in my mind, as the patient, like, what are the stressors
Mm.
and fears that I'm immediately facing right now. And then it's kind of like, well, what would I do in this situation? And in some cases I know the answer, in some cases I don't. And then it's like, well, what is this doctor thinking, and what are their motivations for offering this test or this surgery or whatever. And so it's kind of it's unique in that you're seeing both sides of the coin simultaneously. But I think the best feedback I've gotten on the book has been when I was, so as you can imagine, with these two major surgeries, I was they had me on a ventilator for 26 days. And uh, and and so I was sedated.
Wow.
I was sedated for like essentially a month.
Oh my
And
goodness.
I lived in this completely different reality for about a month. And it was like dreams, I guess you could say, but very vivid and just real, like very real. Like I didn't know the difference that it was a dream or not, because I was under sedation. And by definition, you can't
Wow.
wait, you just can't wake up from sedation. And so I lived in this complete alternate reality, and some pretty wild things happened to me. I faced some pretty serious challenges. But that was very interesting.
Like like when you were in sedation? Like what's one example?
I had gotten out of the hospital and just left against medical advice, and I thought this was completely real, real as paying taxes or something. And I got picked up by a police officer who, probably based on the way I looked with head bandages and everything else, sent me to a psychiatric ward. And there I was, I was in a psychiatric ward, and a woman came and bribed the police officers to release me. And it turns out that she was the head of a drug cartel in New Mexico and West Texas. And she kind of, I wouldn't say hired, but she sort of coerced me into working for her, dealing drugs and marijuana and everything as legally as a physician. And then the story kind of unravels from there. So it was very scary, frightening, intense, and it just seemed 100% real to me, because it was, I mean, I couldn't wake up by definition. I was under sedation, and so
So
very, very
you thought
strange.
this was all happening.
Oh yeah, yeah. And when I woke up, there were 2 or 3 days where, I was asking my wife these questions like, is my dog still alive? Is my, all these things. And she said, yeah, why? What do and it was me trying to get a sense of if those things actually had
Mm.
happened or not. And because I still didn't know, and so it was very weird. It took me probably 3 or 4 days before I actually realized that none of that had happened.
Oh my goodness. So do they tell you this going into it?
No, no, not at all. And I've never really heard of anyone saying that before, like any other patients or anything. But again, most people aren't probably aren't under sedation
For
during
that long?
COVID on a ventilator, yeah, for a month. So,
Right. Oh my goodness. So, okay, so you're kind of going back through all of this and talking about this in your book.
hmm
Wow.
exactly, yeah.
And then where does the artwork, cuz I know you sell your acrylic palette knife paintings. Where does that come in this? Is that something you've always been doing?
Yeah, well, so I not for a super long time. I started doing that as a hobby, or kind of a passion, maybe like a month before COVID really got seated in. And then I had the stroke and everything. But after the stroke, well, my wife and I went to Dallas to do recovery um, in kind of a more comprehensive center, and we were living with family. And so, yeah, after therapy all day, I had nothing to do. And I'm a guy that's used to working 12, 14-hour days, and all of a sudden I have all this time on my hands. And so I just started painting, like, furiously, because it was something I could do, and I could still do it with my right hand. And so it was something I continued to do, and it gave me like a huge sense of validation, like right
Mm,
after the stroke. I mean, I could barely walk. I was walking around with a walker, and things were pretty hard for me, because I went from being, a surgeon, to just kind of a guy going through rehab. And so I think it was validating that I still had a skill that I could pursue, and I wouldn't say make money on, but at least make enough money to pay for my hobby. And so
right.
I kept at that. And then I kind of created a little business around selling paintings, and it just kind of took off from there. And something I still love and continue to do.
I love that. And I'm guessing now that you have your business, I saw the website, looks great. You're still able to fund your hobby.
Right. Yeah. Yeah. Basically. Yeah. I don't think anyone tells you you're gonna get rich painting, but
You never know. Some people
but
do.
uh, but yeah, no, that's what's important, is that I love to do it, and
Exactly.
I can continue doing it. And so, yeah, it's a great thing, and I still do it basically every day.
Wow.
Yeah.
Now, do you talk about your art in the book?
I do. Yeah, I just kind of describe what it does for me in the
Mm.
sense, like in kind of a therapeutic sense, and that sort of thing, and just kind of the fact that it was incredibly validating that I could do something while I literally couldn't do most things. And so and yeah, it ties into the title of the book. Just,
Yes.
sort of a pun on a choke artist, is because it's like I was almost there, and then then this big thing happened, and then it's like, or at least, that fallacy of thinking, the happy ending fallacy, where you're like, yeah, it's, the happily ever after, and you finally get there, and then something totally
Mm-hmm.
changes. But yeah, artist in the sense that I technically am one.
Absolutely. I like here that you shared what's on the back cover of the book, which the first line is, "Have you ever wondered what your doctors do when they get sick?" And that stood out to me because I've had a few doctors on this show. One of my favorites, who I followed for a long time after I went through some autoimmune issues, was someone who's literally dying of lupus, ended up going to medical school. And is now a doctor, but she treats autoimmune disease all through plant based eating and nutrition. And she reversed her own lupus after they said she would never get married, have kids, or survive. And 16 years is totally lupus free, and has done the same for like thousands of other autoimmune patients. So I loved my podcast episode with her. I also found her because of the content that she creates. But what I loved so much is that personal connection and getting to know, hey, you were the patient and also the doctor. And the fact that you called that out is very much like, sometimes, hey, our doctors seem superhuman, right? But like, you're people too, who things happen to. And kind of like, when appropriate, knowing what those things are helps like bring down those walls and barriers and connect us in a way. Um, and also let us know that you're human and you see us as humans too. Which I think can be missing a lot of times in the medical profession. So I guess my question to you is, being on that other side, was there anything that really surprised you?
Like there's some really funny situations where, mostly involving nudity, where where like, people have to watch you shower, and people have to watch you pee, and all these weird things, and you're like, geez, could I just get a little bit of modesty here? But and there are things like, when I was on the other side, it was like, hey, I'm extremely busy, like, and I see this all the time, so it doesn't affect me, but at the same time, I'm not thinking how it might affect them. And I mean, we do certain things that, like, we knock on doors, and we do things like that, but it's like, really, like, are you really paying attention to maybe how they're feeling? And so I think it just kind of opened my mind more to, like, really, empathy is one thing, and we are kind of, you know we're taught that, but we're also human, so we know that, like, I mean, but there's a whole nother level, and you got to recognize your blind spots, and the stuff that you're maybe not paying attention to anymore, because things that seem so, mundane or routine for you, aren't necessarily for this patient who's probably undergoing this thing for the first time. My urology resident thought it was so hilarious that, I had to be catheterized with a urethral catheter, when, you know between him and I, we've probably placed, 200,000 of those things, and but then I had to receive one, and it was like being on the receiving end was so much worse. And so now I can actually tell people, like, hey, this is what it feels like. Whereas before, I didn't really know. I just kind of, this is what most people do. But I don't know. I've always been kind of detail oriented, but now I'm much more detail oriented when it comes to empathy, and like the things that are really probably important to people, and things that a lot of us probably overlook because they've become routine to us, and
Right.
that's not the way to be. And I think, so yeah, big time, this has changed my perspective, and I think it's made me a much better physician.
Yeah. I was going to ask, how are you today? How are you feeling today? How is life and work today?
So I'm feeling great today. A little tired, but that's my usual. I'm back in the clinic right now. I'm doing clinical urology, but I still haven't gotten the green light to go back to the operating room. And personally, I think I can do those things, or at least most of them. I maybe may not be able to do all of the big major cancer cases and things that I once did, but I think I could do 90% of the urology that I used to practice. Um, so we'll see. That's still kind of a process in evolution, but glad to be back in the clinic and seeing people again.
Awesome. I always like to ask a health tip, something that you do or you practice in your everyday life or on a regular basis, something that you'd say helps you show up as your best self, or helps you feel the best each day.
Hmm. So since the stroke, I've completely cut out alcohol because it makes me it worsens the unbalanced. The alcohol it affects your cerebellum.
Mm.
That's why you get all wobbly if you have too many drinks. So I
Mm-hmm.
completely cut that out, entirely, and it's made me feel amazing. Like I lost 20 pounds. Um,
Wow.
so I lost 40 pounds from the stroke, and then
Mm-hmm.
and then eventually gained it all back, plus a lot more because I'm not able to do the same
Mm.
exact, physical activity that I was
Right.
doing before. But yeah, certainly cutting that out just helped. I think I just cut out a lot of carbs. It made me think more clearly, sleep a lot better, and yeah, I don't know. And I do a lot of like plant-based smoothies and stuff in the morning, and that usually makes me feel really good in
Yeah.
the morning. And it
They give you great energy. I do that too.
yeah, yeah.
Well, is there anything else that you wanted to add that I didn't ask you?
Um no, just where to find the book. I
Of
it's on
course. That was
yeah,
next
it's
on the
on
list.
yeah, so it's called The Stroke Artist, and it's on Amazon and Barnes and Nobles. But you can also kind of look at my book and paintings on my website, which is currently The Stroke Artist, all one word, .myshopify.com.
Awesome. Yep. And I'll make sure we link to all those links down below. I didn't see, do you have social media?
I
I
do,
feel like we're
yeah, yeah.
okay. I didn't know if you have a place where
So,
you want people to connect with you and find you on social as well.
sort of, right? Yeah. So I have it's at Bevan Choate on Instagram.
Sounds good. And then lastly, I will ask, because I know your story so much about going through what may seem like an insurmountable challenge if somebody else finds themselves, whether it's a stroke or something else, a major life changing event. What would you say, words of advice or encouragement, when faced with a storm?
So be patient with yourself. And I think human beings are very linear people. We want to see this constant increase, this constant rise. But when you're dealing with things like stroke or maybe going through a major medical event or surgery and things like that, the it's a step ladder. It's not a straight uphill climb to the top. It's
Yeah.
you're gonna make little improvements, and then you're gonna ride along maybe for several months, maybe even a year of no improvement in your mind, and then you'll go up to the next rung, and then you keep going. So it's kind of a step ladder, and I think keeping a journal is a pretty good way to actually have something you can look back on and see the progress that you've actually made. Because I mean, shoot, if I don't do that, I'm just like, it never happened, like I don't
Yeah.
remember it. And and that's wrong. So I think journaling or whatever it is, whatever
Yeah.
is helpful in that regard to actually show you, hey, this is actually where I started out. This is how I
Hmm.
was feeling. This is what I was doing, and now look at me. Um,
Absolutely.
yeah,
Yeah, I think of that too, and I think I do that a lot too with video content. One, having been a television journalist and having a ton of content from the beginning of my career, but even from having these kinds of conversations, We're over podcast 100. I've been doing this over 2 years. And then other sources of content. Like I kind of see this in a way like a video journal, and being able, you can look back and even see the growth, or just see, hey, what my mindset was back then and how that has evolved and changed along the way. So sometimes I do that. And it's nice to have like that video journal, I guess you could say.
Yeah, exactly. It's pretty awesome. So yeah.
Awesome. Well, this has been really great. I'll make sure to link to the Instagram, the artwork website that you shared with us, as well as where to find the book down below, so people can find that, connect with you, and all the good things. So I really appreciate it. Thanks for sharing your story.
Yeah, absolutely. Thanks for having me on.
You're awesome, and keep inspiring.
All right.
And being that empathetic doctor. We appreciate that.
Will do. Yeah, for sure.
One of my biggest takeaways from that interview with Bevan was when he said, life is being happy while you're in the storm. I couldn't agree more. Great takeaway. Also loved what he said about empathy, and that we could all use more of it, which is so true, especially in the healthcare field, but really applies to all of us. Great message. Make sure you go ahead, check out his book, check out his website where he has his artwork linked as well. All of that is down below in the show notes, so connect with him. And hey, also connect with me if you haven't already. I don't know why not. I'm all of the places. You can find me on Instagram, Facebook, Twitter, LinkedIn is where I'd love to see you, and also, hey, YouTube, where you can go ahead and subscribe, turn on notifications, because you know what? We come back every other week with new episodes, and I'd hate for you to miss out. So until I see you back in 2 weeks, stay happy, stay healthy.